Welcome to The Explainer. Deep inside you, there's this incredible digestive support team. It works silently, perfectly, right up until it doesn't. And when it goes wrong, it's a real crisis.
I mean, seriously, what if your body's own digestive juices started, well, digesting you? It sounds like something out of a horror movie, right? But for two really important but often overlooked organs, your gallbladder and your pancreas, this is a real and incredibly dangerous possibility. So let's dive in and see what happens when these guys go into crisis mode.
Okay, first up, let's meet the key players. Think of it like a delicate digestive team. We're talking about the liver, the gallbladder, and the pancreas. They're the ones making all the important stuff your body needs to break down food. But when this team gets out of sync, man, the consequences can be really, really severe.
So to really get what can go wrong, you got to understand their jobs. They're different, but they work together. First, you got the gallbladder. Think of it like a little reservoir. It just stores and concentrates the stuff called bile, which the liver makes, and then it squirts it out when you eat something fatty like a burger. Then there's the pancreas. This thing is the factory. It's churning out this powerful cocktail of enzymes to break down basically everything else. Starches, proteins, you name it.
All right, so let's zoom in on player number one, the gallbladder. What happens when this little guy comes under attack? This is a condition called cholecystitis, and it's something that affects a ton of adults, especially in more developed countries.
Yes, so the official name is cholecystitis, and all that really means is an inflamed gallbladder. It's super painful, and almost every single time it's triggered by a physical blockage. And what's causing that blockage? Well, it's something surprisingly common.
So what is the main culprit here? Get this, in a staggering 95% of these acute cases, the problem starts with gallstones. These are literally hard, pebble-like little crystals that form inside the gallbladder. And when just one of them gets stuck in the exit pipe, boom, it sets off a crazy, painful chain reaction.
So you're probably wondering, how can one tiny stone cause so much pain? Well, it's basically a four-step disaster. First, these stones form from stuff like cholesterol. Then, one of them gets lodged in a duct, blocking the exit. Now, all that bile is trapped. It gets concentrated, it gets angry, and it starts irritating the gallbladder wall. And finally, that wall gets inflamed, it gets swollen, and if it's not treated, it can even get infected and rupture. Not good.
Okay, so who is most at risk for this? Well, for decades, doctors have used this little memory trick called the 4 Fs. It's a heuristic, right? Not a perfect rule. We're talking female, 40, fat, and fertile. Now, as the source material points out, this isn't absolute. Thin and younger women can get them too. But things like female hormones, being overweight, and being over 40, they definitely ramp up the risk.
And here's something pretty amazing. This internal plumbing problem actually creates very visible external warning signs. See, normally, bile is what gives your stool its brown color. But when that flow is blocked, the stool turns a pale clay color. So where does all that pigment go? It backs up into your bloodstream, and then your kidneys filter it out, which makes your urine super dark, sometimes even tea-colored. If you see those signs, that is a classic signal that something is seriously wrong.
All right, now let's shift gears and talk about the pancreas. Because if you thought the gallbladder situation was bad, a blockage here can trigger an even more dangerous crisis. I mean, as intense as gallbladder pain is, when the pancreas gets involved, things can get life-threatening fast.
And this brings us right back to that horrifying question we started with. The condition is called acute pancreatitis, and it is absolutely terrifying. Why? Because those super powerful digestive enzymes the pancreas makes, they're supposed to stay off until they reach your intestine. But here, they switch on prematurely, inside the pancreas itself. The result is a process called autodigestion. The organ literally starts digesting itself from the inside out.
So what on earth triggers this kind of self-destruction? Well, the number one cause, accounting for about 40% of cases, should sound pretty familiar by now. It's a gallstone. One of those rogue stones gets stuck in the common duct where both organs drain. And the second biggest cause, at 30%, heavy alcohol use.
And the pain? Oh, the pain from this is on another level. It is uniquely severe. The source material describes it with this really specific word, boring. And they don't mean it's uninteresting. They mean it feels like something is boring a hole straight through your body. It's this intense, continuous agony. And patients often say the only thing that brings even a little relief is curling up into a ball.
And you can actually see the evidence of this internal destruction in blood tests. As the pancreas gets damaged, it starts to leak,
And these key enzymes, amylase and lipase, just skyrocket in the bloodstream. I mean, the levels go way, way up. At the exact same time, calcium levels in the blood start to drop because it's getting used up in all that inflammation. For a doctor, seeing these results together, that's the smoking gun.
But what happens when these attacks aren't just a one-and-done thing? What if the damage keeps happening over and over? Well, that's when it can turn into something even worse: chronic pancreatitis. With chronic pancreatitis, the organ becomes permanently scarred up, and as that scar tissue builds, the pancreas just stops working properly. This leads to this relentless, gnawing pain and some really severe digestive problems. The body literally can't absorb fats anymore, which causes this very specific symptom called steatorrhea, basically fatty, foul-smelling stools. And if that's not bad enough, over time the damage can wipe out the cells that make insulin, which ultimately leads to diabetes.
And this ongoing cycle of damage, inflammation, and scarring, well, it brings us to the ultimate threat when it comes to the pancreas: cancer.
You know, pancreatic cancer has one of the absolute lowest survival rates of any cancer. And a huge reason for that is its location. It's hidden. It's tucked away deep in the abdomen, behind the stomach. This means a tumor can grow and even spread for a long, long time before it causes any clear symptoms. And by the time it's found, it's often just too late.
Now, when surgery is an option, the main treatment is this absolutely massive operation called the Whipple procedure. And the complexity here is just staggering. I mean, listen to this. Surgeons have to remove the head of the pancreas, the first part of the small intestine, the gallbladder, and even part of the stomach. And then they have to surgically replumb the entire digestive system. It's one of the most difficult and demanding operations in all of medicine, not just for the surgeon, but for the patient too.
So, okay, after seeing this whole cascade of what can go wrong, from a simple stone to something truly devastating, the obvious question is, what can we do? How can you support this internal team and lower your risks? So what are the big takeaways here? Well, since we know that gallstones and alcohol are the two main culprits, the most effective things you can do are pretty straightforward. Manage your weight and your diet, especially high-fat foods, to help prevent gallstones. And of course, avoid excessive alcohol. But really, the most important thing is this: you have to listen to your body. Don't ignore persistent or severe abdominal pain. After everything we've just talked about, it's pretty clear that's a warning sign you just can't afford to ignore.
And that really leaves us with one final thought to chew on. Your internal digestive team, your gallbladder, your pancreas, they are working for you silently 24/7. You never even think about them. But understanding just how delicate that system is, well, that's the first step to giving it the support it needs to thrive and to keep you healthy.